We're also digging into problems with the Department of Mental Health's debt and the impact that could soon be felt across Green Country. 2 News Oklahoma's Steph Manchin shows us how a Tulsa program champions those on their last chance with the law and why it could cost taxpayers more if it went away.
If we lost our funding from the Department of Mental Health, we would not be able to sustain.
For 30 years, the Tulsa County Alternative Courts program has served thousands of Tulsans, rehabilitating and shielding them with a second chance.
If you didn't have drug court, where do you think your life would be?
Oh, no doubt, prison. You know, there's an old cliche saying, the streets only has two endings, death or prison, you know. And I have no doubt it would be one or the other.
Matthew Winchester graduated from their drug courts program in 2022.
I wasn't a very good human being before. I wasn't a good father. I wasn't a good brother. I wasn't a good friend, a good son. I wasn't employable. I was a terrible human being, and it was time for a change.
He's celebrating 4 years of sobriety this year. Stories like his, though, could soon be few and far between. The majority of TCACP's funding comes from the Oklahoma Department of Mental Health and Substance Abuse Services, which has been in the headlines for the last several weeks for serious financial woes. Now, the proof that this program works is all in the numbers. For recent drug court graduates, they saw a 98% decrease in unemployment and an 81% decrease in those lacking a GED or diploma. So losing this funding would significantly hurt the people needing treatment, but it would also hurt taxpayers. Their 2025 felony drug and mental health court class saved almost $2 million. That number comes from comparing the cost of treatment court to the prison time they were facing. Erica Jeffords, the program director, says to lose the alternative courts would have ripple effects all across the state.
You're looking at higher rates of incarceration, potentially increases in crime because individuals who are suffering from those diseases are not getting the services that they need. And ultimately, there's going to be more people suffering.
Their goal being to reintegrate their graduates into society and teach them not to go back to the situation that led them to a prison sentence in the first place. Although it's been about 4 months since they've heard anything about funding from the Department of Mental Health, Jeffords says she and her team are remaining hopeful that their funding will come through. In Tulsa, Steph Manchin, 2 News, Oklahoma.